Okay, gotten that wax off. Try placing my tooth. Okay, there is enough space. Now I can move my tooth around. When it comes to a canine, remember that the canine has to be vertical. That means that the neck of the canine is usually the most prominent part of the tooth. So if I were to place it here, if I were to place it here, let me place it here in some soft wax. You can see clearly that the neck is prominent when it's placed straight. So I'm just going to place it like that. Right. Again, take care to have my tooth in line. So let me put some wax so I can stabilize that there. Okay. So now you can see that my canine is also in line with my arch. So I hope that is clear. So you can see from the pencil marks that it is in line. Okay. The mesial part of the canine, of the incisal edge of the canine is in line with the anteriors, and the distal part is in line with the posterior part of my rim. Now, having done this, there's an important thing that we need to do, that is to check if our teeth are in line on the glass plate. As you can see, they are not. Okay, so I have to adjust my occlusal levels. I'm just going to adjust it. Just going to bring my incisor down a little bit. It's preferable to do this when you place each individual tooth to do it at the same time so that the tooth is corrected in position. Okay, as you know, the central incisor must touch the glass plate or should be in line with the occlusal plane. The lateral incisor, of course, should be 2 millimeters above the occlusal plane. Okay, in an older patient it can be even a bit less, and the canine tip should be touching the glass plane. Just adjust this. Okay, so now my central incisor is touching, as you can see. Central incisor here is touching the glass plate. My lateral incisor is above. The back end of the carver is just there. If you really want to check the spacing, you could just put your carver, it goes in. Or from the back, if you want to see, you can see very clearly that there is a space for my Lacrant's carver tip. So you know that that's about 2 millimeters, and you can see the canine, it's touching my glass plate. Now, of course, I have some space here, so I'm going to fill it up with wax. I'm going to, from the front, when you can see the canine, the neck of the canine is prominently out as compared to the neck of the lateral or even the neck of the central. So this is how it should look, because that way it looks aesthetic.